Welcome, Joslyn Center Facebook Live fans. My name is Jack Newby. I'm the Executive Director here at the Joslyn Center. Welcome to Interview Fridays. We have an interview coming up regarding Medicare and the open enrollment period, which ends in just a few days. Before we get to that, I want to cover a couple things that are happening here at the Joslyn Center. First thing I wanted to let you know, there is a scam going around, and I can tell you it's true because I was called by someone. If anyone calls you, and it seems to be from people that we may be doing business with, I had one report from someone who got this call from Spectrum. I received it from a credit card company. If you have something on your phone that shows you who's calling, that it has their name there, but they ask you to confirm your identity by giving you giving them your date of birth and your social security number. Don't do it. You will be in a lot of hurt. These companies, this is how they get your information, and then immediately begin using your information and your good credit to go out there and make purchases. So no legitimate company that you do business with will be calling you and asking you to confirm your date of birth and your social security number. So even if your phone says it's a company you do business with and you're familiar with, don't fall for it, and perhaps call them directly on the number that you have on your statement if you're concerned about it. Also coming up, we have in our wellness center, our brain boot camp, very popular course, great for learning how to improve your memory, learning about brain health, to keep your brain healthy as you grow older. And that's coming up on December 7th and 14th. We ask you to register. It's at 1 o'clock in the afternoon. So call 760-340-3220, extension 117, and register for Brain Boot Camp. Also, our holiday luncheon, and we're getting close to being sold out. So you want to come in and get those tickets as soon as possible. They're cash. We're selling them on site, and you sign up and get your ticket. That's on Friday, December 16th, noon to 2 p.m. Tickets are on sale now. And as I said, space is limited and tickets are going fast. So we're happy to thank Desert Oasis Healthcare for sponsoring the Joslyn Holiday Luncheon on December 16th. Also, we have two great programs that we're working on right now, Supplies to Thrive. So we ask that you provide full-size health and hygiene supplies for seniors. So that's shower gel, shampoo, bars of soap, conditioner, body lotion, razors, shaving cream, those sorts of things. We have drop boxes in our lobby, and you can drop those off, and we will make sure those are delivered to our homebound seniors receiving Meals on Wheels, as well as made available to our clients that come in for our Penny's Pantry food bank. And also we have our holiday gift drive. So we have a holiday tree in our lobby, and you can choose an ornament from one of our Meals on Wheels recipients, and they have put in gifts that they would like to receive or things that they need. And most of them are very simple things like socks or bathrobes or slippers or something to keep them warm, just very simple things. Some of them say, just surprise me, and it gives their name and their age. So we ask that you pick out that ornament, register at the front desk, and then return it by December 15th so we can make sure we make the deliveries to our clients. So that's what's coming up here at the Joslyn Center. We've got an important deadline coming up, and that is with Medicare. So we have with us Brian Bilhartz, Brian with Bilhartz Desert Insurance, right?
Yep. You got it, Jack.
And Brian is our resident expert on Medicare and Medicare Advantage plans. So Brian, tell us first a little bit about what's coming up and the deadline that's coming up and some of the little kinks we have in that system here in the Coachella Valley.
Oh boy. Well, first of all, Jack, thanks for having me back on. I'm glad to be re-invited. So yeah, we're just a couple days away. We've got the annual enrollment period ends December 7th. So we're knocking right on that door. But some of the things that are happening right now, specifically, we have those people who are members of the Inter Valley Health Plan. Inter Valley Health Plan is going to be closing its doors as of December 31st. So people who are currently enrolled on that plan, if they do not make a selection starting January 1, they will by default be on Medicare, original Medicare by itself, without any prescription drug coverage either. And once you reach January 1st, the earliest you'll be able to sign up on a new plan would actually be February 1st. So you can go a whole month of just having Medicare coverage by itself. And that could be a scary situation.
Very scary for people. So if you have, and that's Inter Valley Health Plan, if you have a Medicare Advantage plan through Inter Valley Health Plan, you be sure and call someone. And Brian, what's your number if they want to call you and ask any questions?
Yeah, my number, and maybe even better than calling would be sending a text message, because the call volume is quite significant at this point. But my cell phone number is 760-459-9617. Yeah, it's one thing though, Jack, that I want to make sure that our viewers and listeners are aware of. Again, if you are currently on Inter Valley Health Plan, you've probably been receiving phone calls and text messages. I know Desert Oasis has had a really strong campaign to bring that awareness. You're not really bound by the December 7th date, which is good news for those members. Technically speaking, Jack, those affected members will have until February 28th to choose a new plan. But again, you must consider that if you don't make a choice by December 31st, again, specifically for people that are currently enrolled with Inter Valley Health Plan, you don't make that decision by December 31st, January 1, you will be on just original Medicare by itself.
And that could be very difficult for some people, especially if they're dependent upon the drug coverage, because you said that does not renew. And also if they have specific doctors they are accustomed to seeing, that may present problems as well.
Yeah, there actually are certain providers, actually some of the more popular providers with Desert Oasis, that absolutely will not see patients that are covered under original Medicare. So come January 1, there could be a lot of really angry, upset people, not being prepared, to make sure that they make that switch to the new plan.
So Brian, I have to ask you this. I sit home sometimes, I'm watching TV and there's all these television commercials about call us, do this, do that. If you're in this zip code, you'll get extra money and all that. What is that all about?
Well, what is it all about? It's all about them wanting to get you to dial the phone number. And I don't necessarily want to call it a scam. I know that, you kicked us off here talking about some scams, and it is terrible what people will do to try to manipulate, some of our aging residents here in the Coachella Valley and beyond, because it's not just, isolated here. Those commercials, there's some truth to it, but I'll tell you, Jack, I'll give you a brief situation. I've got a client of mine who responded, called Joe Namath, right? He's one of the characters on those commercials. So called Joe Namath, and anyways, make a long story short, the gentleman she spoke with on the phone never once asked her about her prescription drug coverage, put her on a plan where her medications weren't covered. And had she stayed with that plan, she was going to have to pay over $14,000 this year for her medications. The day after she made that phone call, she called me. She said, something doesn't feel right. And fortunately, because we're still within that enrollment period, I was able to move her back to the original plan I had her on, where her medication costs were only going to be $3,000 for the year. And again, the guy on the phone cared nothing more than to get an enrollment, because he knew he was never going to meet her. He knew he was never going to see her. He knew he was never going to run into her at a supermarket or at the grocery store, a restaurant, anything like that. So it was really easy for him to just say, okay, let's get your information. Let's agree to your verbal signature, and away we go.
Well, and that's an important point, because all these plans are not the same. And so unless someone goes through it in some detail to find out if their doctors are covered that they have a relationship with, and as you mentioned, their medications are covered, which we know are probably a lot more expensive than your doctors.
Yeah, exactly.
That you could be in a really bad situation. So one of the things I also wanted to ask you about is what happens if someone somehow misses, for whatever reason it is, that December 7th deadline.
So if we're specifically talking about Inter-Valley people, like I stated, they have until February 28th to make a choice. But for other people that are maybe also on a Medicare Advantage plan, but with a different company, there is a secondary period. It's what they call the Medicare Open Enrollment period, and it goes from January 1st to March 31st. Medicare is very specific on the do's and don'ts when it comes to when and why and how you can change your plans. So specifically during the Medicare Open Enrollment period from January 1st to March 31st, if you are an existing Medicare Advantage member, you will have an opportunity to make a one-time change to another Medicare Advantage. Or if you're on a Medicare Advantage plan, you can make a one-time change to go back to original Medicare with what's called a standalone prescription drug plan. Now, that second case that I just explained does not give you what's called guaranteed acceptance to a Medicare supplemental insurance plan, because these Medicare supplement plans are actually life insurance products, and in most cases they do require medical underwriting.
I didn't know that at all.
Oh, Jack, spend a few minutes with me. That's what I tell my agents every day. The more time you spend with me, the more little nuggets you'll pick up. I mean, this is my 16th enrollment period that I've been through. So, fortunately, I've met a lot of people who've had a lot of different situations, and I've learned a tremendous amount through that.
Well, it's always good talking to you, because I always do learn something. Let's do a little Medicare 101. Yeah. So there's standard traditional Medicare, Part A that covers hospitalization, Part B that covers your medical care with doctors. If you want drug coverage, and there's Medicare Part D that you would have to sign up for. So I think I've covered that kind of part of traditional Medicare. And if you want to try and reduce some of your out-of-pocket costs, you can sign up for the Medicare supplement plan that we just mentioned to help cover some of those out-of-pocket costs. And then there's Medicare, I think it's Part C, which is the Medicare Advantage plans. And that's what that covers. Not only the same things traditional Medicare covers, there are also some plans that cover vision and dental.
Yeah, so I like to refer to that C, think of that as combined, because you're combining your A, your B, your D, and then also sometimes additional benefits, dental, hearing, vision, transportation, over-the-counter benefits, chiropractic and acupuncture. There's a lot of different little bonuses that these Medicare Advantage plans provide to sweeten the pot for you. And true to those commercials, Jack, there are several of these companies where not only Medicare Advantage plan companies that not only have a $0 monthly premium, meaning you don't have to pay anything above and beyond your Part B premium, but they do actually give you money back on your Social Security check. Anywhere from $50 to up to $164.90 every month, they will rebate back to you if you sign up on that plan. I mean, who's heard of an insurance company that gives you money to join them? It just doesn't exist. Yeah, but in all things, Jack, there's pros and cons, right? I really love these Medicare Advantage plans, and I support them very well, because I think for, most of our Medicare eligible residents here in the Coachella Valley, they have great, healthcare systems through Desert Oasis and Optum Desert Cities and Coachella Med and Primary Care Associates. There's a lot of different groups that provide, access to care for HMO plan members, but it's not always right for everybody. And that's why we come in with these Medicare supplemental plans for people that prefer to have access to, say, doctors at Eisenhower. The Eisenhower system isn't affiliated with any of the Advantage plans, so you would have to go under a Medicare supplemental insurance plan. And that's our job, is not to try to tell people what they need to do, but to teach them the pros and cons about both sides of this story, because the supplemental plans give you that freedom to kind of choose, your doctors without being part of a network, without having to have referrals. But obviously that freedom is not free. You have to pay premiums for those supplemental plans and that Part D prescription drug plan.
Now, we've been talking about Medicare Advantage plans, and most of them are under the HMO system, where you have a primary provider and they make referrals out. Are there any similar plans that are PPOs, where they're preferred providers and you can make your choices?
Yeah, so actually, Jack, this year, there are now 3 Medicare Advantage PPO plans. 2 years ago, Aetna introduced a Medicare Advantage PPO plan. And then this year, actually starting for 2023, United Healthcare is bringing 2 Medicare Advantage PPO plans to the market. Typically, the difference between these PPO plans and a Medicare supplemental plan is the PPO plans are going to have a lower monthly premium. Your Part D prescription drug benefit is going to be integrated because it's still a Medicare Advantage Part C, where you're combining all of your benefits under one plan. They're going to provide and offer the vision, the dental, the hearing aid coverage, the over-the-counter, a lot of those services that aren't available under the supplemental plan. However, you still have PPO, preferred provider organization. You're going to have some doctors that are in network, some doctors that are out of network. You'll pay a higher fee or co-payment for your out of network providers, but you're still not part of an HMO network. Those plans, they're gaining traction. They're gaining in popularity. I'd still say the number of Medicare Advantage enrollments that we get are a long shot majority HMO plans, but the PPO plans are starting to gain popularity. And I think more and more people, are starting to talk about them. And that's probably one of the reasons why you brought it up, because you're hearing people talking about these
Yes.
PPO plans.
There's a lot of questions that people need to have answered, especially if they're new into Medicare, or maybe have been in it for a year or so and really are not happy with what they're doing. How long does it take to go through that enrollment process? And for most people who are not part of Inter Valley Health Plan, 5 days away from this deadline.
Ironically, Jack, the pandemic really streamlined that part of this business, because prior to the pandemic, we were still old school, doing paper applications and faxing them in, and pages would get out of order when we'd fax them, faxes would get cut off. We were dealing with a lot of those types of headaches. And then the pandemic hit, and most, especially Medicare beneficiaries, isolated themselves for fear of exposure for obvious reasons. And so the insurance carriers and even Medicare really started looking at the options and ability to do this electronically via emails and text messages. And so that whole process has definitely improved over these last couple of years. So it's a very, very simple process as far as the actual enrollment is concerned. For myself and my team, really the most important thing that we do first and foremost is we do that prescription drug comparison. It's nice to have dental coverage. It's nice to have coverage for your glasses. And it's nice to have over-the-counter benefits and transportation. However, your prescription drugs are just like your electricity bill. You have to pay them every single month. And just like the example I gave in the beginning, the $14,000 compared to the $3,000. Like there is no dental benefit or hearing aid benefit or any other benefit that's going to offset that significant of a difference.
Right.
So we always start with the prescription drugs, and then we go from there. What are your wants? What are your needs? What do you have that you like, and what do you not have that you wish you had? And then we take, because right now there's probably, I don't even know the total number, I'd say over 80 different Medicare Advantage plan options. And with that, we take it, we narrow it down, starting with the prescription drug coverage, and leave it to where we give our clients 2 or 3 different options based on what their needs are, so they could choose the plan that they're most comfortable with.
So if people have questions, what number should they call again?
Hang on, Jack, I lost you for a second. Maybe you lost me too.
No.
Oh my gosh, I'm so sorry. I don't know what happened. Earbuds. So it shows that I'm connected here.
I can see you and hear you.
There we go. I can hear you now. I had a phone call that came in, and I think the phone connected to my earbuds. I'm sorry about that.
Yes.
It's that time of year.
So if someone's going to call you, what number should they call? But not
here. Text message. Oh my gosh. My cell number 760-459-9617.
And before they call you, what should they do?
Ooh, boy, that is a great question, Jack. Number one, like we were just discussing, have a list of your medications. And a lot of people's medication list hasn't been recently updated, and medications, change names. So make sure that your medication list is updated, and it's the names that are on the bottles of the medications that are in your cabinet. Because that can make a significant difference when we start going through doing this comparison. Number 2 is make sure you have your new, and I hate to call it new, make sure you have your new Medicare card. Back in 2019, Medicare issued new cards to every single Medicare beneficiary in the country, because prior to 2019, Medicare cards had your Social Security number on it. And they finally removed that after all these years. So the new cards, they're still red, white, and blue, but your ID number is just a random alphanumeric number, just a combination of letters and numbers. I believe it's 11 digits long, still has your same Part A and Part B effective dates. Make sure you have that card. And if you don't, we have ways where we can, get that number, but it kind of slows down the system, especially, getting this close to the end of the annual election period.
So people should be prepared before they call you, and that you can get them the best information for their particular situation if you have that information in advance.
Yeah, and the key to that, Jack, is really just making sure that you're working with a local agent. And so this isn't necessarily a commercial or campaign for Bilhartz Desert Insurance Agency. If you have an agent, just make sure that they're local. Make sure that they're local, that they know who all the players are. They're familiar with the different systems that are out here and what insurances they take and what insurances they don't take, because otherwise you're going to end up like my client who called Joe Namath and, was going to be put on a plan where her medications were going to, almost quadruple in price. So yeah, just work with somebody local. It's so important.
Yeah. Those commercials are almost as bad as the ones we had in the political campaign for the for the offside gambling or whatever it was.
I don't know what's worse, Jack. Those are both pretty darn close, aren't they? Terrible.
So cost, what is the cost taken out of the Medicare check? Are there additional costs that people have to pay individually? How does the cost work and the payment work?
So I think the first part I want to address in that, this is a question that we do get asked often, is what do we charge for our services? There's no charge to use a broker. And it's not just that we don't charge any fee, it's clients don't lose anything when they use a broker. Sometimes maybe for your auto insurance or for your financial planning, you're having to pay them a portion, a percentage, or a flat fee. You guys don't pay us anything. You don't lose anything. You don't have different benefits. You don't have different coverage. You don't have different premiums if you use a broker. So that was first and foremost. Second part to that is With the Medicare Advantage plans, there are no premiums unless you want to, in some cases, add like additional dental. A lot of the carriers this year have a PPO dental option that you can add anywhere from, 20 to 50 some odd dollars a month. You can choose how that premium is paid, whether it's deducted from your Social Security check or have it automatically deducted from a checking account or something like that. Some cases they will allow a credit card. But again, the Medicare Advantage plans don't have an actual premium to them. They're all basically a zero premium, except for the plans that will give you money back. And then on the supplemental plans and the Part D, the standalone prescription drug plans, again, those premiums, sometimes they'll give you the option to deduct from Social Security. Most of the time, especially on the supplemental plans, it has to be set up as an EFT, as an automatic withdrawal from your checking account. And I will tell you, any situation where they give you that option to pay it through your Social Security, I always advise no, because you don't want to depend on Social Security and to send the payments to your insurance company in a timely manner, because if they don't, it's your policy that's going to be canceled. And Social Security is not going to worry about it, but it's going to be your policy that's canceled. So I just don't advise that.
So good advice, as always, from Brian Bilhartz. I really want to thank you for joining us. And for those of you that haven't yet made a decision about your Medicare enrollment, or if you're part of InterValley Health Plan and need some additional advice, what is that text number again?
760-459-9617. And even if any of our viewers are eligible for both Medicare and Medi-Cal, there's even changes there too. So just a whole lot going on, Jack, but I definitely appreciate the time that I've been able to spend with you today.
Okay, well, I really appreciate it. You're the expert in the field here that we know. So appreciate your spending some time with us. Hope you have a great weekend. It'll probably be a busy one.
Yes, sir.
And a great holiday season to you if I don't see you before then.
You as well. Thank you so much, Jack.
Thank you so much.
Thank you, everybody. Bye-bye.
Bye-bye.